Hi, my name is Dr. Nilse Santos. I'm a pediatrician and I have been practicing since 2021. Growing up, I was lucky to have a pediatrician that was a woman of color. So that was my first introduction to medicine. And seeing myself in her made me realize that medicine would be a possibility for me. I've also always been a very curious child, but only once I came to the US at the age of 17 and I had the opportunity to work closely with children in the education field did I realize that I would also like to make that as a part of my career. So I found medicine to be a good way to combine those two things to nurture their future potential as well as making sure they become healthy adults. It's very helpful. It makes empathizing a lot easier with the parents, especially because I had my son. He was like a newborn when I started residency, so very high stress moment, which kind of just amplifies all the things that new parents experience. So very often I'll tell my parents like I understand, like you try your best and we'll figure it out, which is basically what I did. So it's easier to tell them to do things. And when they tell me, oh, he just won't sleep, and I'm like, I know, you're doing what you can. Every visit will look different depending on what stage the child is at. As a newborn, I like to start the visit by asking the parents how the child is treating them. It's a good way to kind of normalize whatever struggles they might be having, and we can address concerns as we move along with feeding and sleep and all that. As toddlers, we focus a lot on the milestones, making sure that everything that they need to meet is met and how we can support that. And finally, as teenagers, around 13, 14, that's the age that we encourage teenagers taking more ownership over their health. And we actually ask the parents to step outside so that we can discuss whatever topics might be difficult to initially introduce to the parent. One thing that parents and my patients might not know about me is that I'm of Cape Verdean descent, but was raised in Portugal. So Portuguese is my native language. I also speak Spanish as a result of similarity of the languages, and I love to work with patients that speak those languages.